And so I know that there are probably a lot of questions in the audience. Hi back there to you, Tracy. You're over, I don't know if you can see us. Can you see
I
us?
can, yeah, I can see you fine. Yep.
Hello.
Yeah,
um,
well,
so I'm going to just lead off with a question. And I think that both of you made the point that it's very difficult to capture the benefits to health from these ocean-related ecosystem services. It's difficult to capture them. It's difficult to quantify them. And I take it it's especially difficult to quantitate them economically in terms of, as you said, Tracy, that you didn't have the ability, you could talk about direct impacts on the economy, but I think impacts on health are impacts that are economic impacts, but we don't seem to have quantitation of that. And so a question that I would have for both of you is, what do you think we need to know to better quantitate the impacts on health, and particularly to do so economically? Do you think that this is a question that involves more research, or that we already know what we need to know, but we need to do more work on the economics? Where do you think we need to be going to do that? Go ahead.
So I'm not a marine and coastal expert, so not all my examples will be marine and coastal. My sense is that on the health side, in some ways we do a lot better of doing economic value. I think about the models that have been done for looking at air quality policies, and we've done a really amazing job of linking new Clean Air Act revisions and policies to different health outcomes and the value of those health outcomes. I think there's some of the best examples out there of ecosystem services valuation. I think that we do have trouble going from a range of different services to those health outcomes, and those, and especially health outcomes that are less concrete. So I think the cultural sciences, the cultural services, spiritual, solitude, mental health connections are, of course, probably more difficult to make than some of the air quality asthma linkages. And I think the linkages between these indicators of the ecosystem services to health are where a lot of the work probably needs to take place. But once we get to the health impacts, it seems like there's been a lot of research on the valuation of those. So that's, not an expert in it, but that's my sense.
and I would agree. I mean, I think, yeah, if we get to the health outcomes, we can do the economic valuation pretty well. But it's getting to those health outcomes, especially with marine ecosystem services. I agree with you that the example of air quality and its link to human health outcomes is really, I mean, I'd love to have something like that for PCBs and salmon in Puget Sound. I think a lot of people are grappling with this in different regions. So I think that, I don't know that we need more specific research right now as much as we need to have that discussion and coordination between people that are undertaking these efforts. So we've got a bunch of people out here that are working on a quality of life index. I know they're aware of some other folks that are doing it, similar things, but we really need to have some consistency in our approach, I think, and in our messaging. It may be that for now we're only going to have really strong narrative descriptions of the health outcomes associated with degraded marine and coastal ecosystems. If we had that consistently, I think that would go a long ways. And then we'll just hire the economists to do their magic and turn the narrative into numbers. So,
Dick.
Terrific talks. Richard Jackson, UCLA. One observation, two facts, and perhaps a suggestion. Observation is one of my favorite places to hike in the world is Point Reyes, National Seashore, and they have, over time, let many of the trails grow over so they've become impassable. And when I've challenged the ranger about it, he says, well, you know, really it's for nature out here, it's not for people. And I really have trouble with that, because if the middle class stops and caring about this, it's going to be tough to have the political support going forward. And I've noticed more and more, I see a lot of people my age hiking and less young people. And I think that going forward is a problem. The two facts. One is fresh water is going to be increasingly important going into the future. In Los Angeles, where I am, groundwater is 6 times cheaper than water brought in from the Owens Valley and the Colorado River. Where I'm going with that is we don't adequately argue for permeation of water into the ground, a major service to nature and to health. And I think that we have not muscled this adequately from either, especially from the health world, but maybe not from the economics world as well. The third last fact is the obesity epidemic. I won't go on about it, but human beings, Americans need to be much more fit. We need to be much more active. So in the observation then, Christine Gregoire said, and I don't remember the third one, everything around the sound should be swimmable and fishable.
And diggable, because we have clams.
And diggable, thank you. I would like to argue that it ought to be walkable, bikeable, and that we ought to have permeable trails going all the way around. It goes back to my original argument, the more the average person loves and cares about a place, the more support you're going to get going forward.
And I'll just comment, I was going to comment quickly on that. I'm on this Delta Science Board for the San Joaquin Sacramento Delta. Yeah, fresh water is a huge, huge issue. And you'd think it wouldn't be that big of an issue for us up here with all of our rain, but in fact, the groundwater flow, the hyporheic flow under the rivers, is increasingly recognized as something that we are not protecting well enough because of our water withdrawals for domestic unregulated wells. It's something we're going to have to deal with even here in the rainy Northwest. So I agree with you totally.
We have a few questions. Frank?
Very good presentations. I want to say something about quantification for a moment. I mean, it is absolutely vital, not only because this is a scientific inquiry, but also because that is the way you persuade a lot of people of the importance of what you're doing and what you're trying to protect. I would put a little cautionary sign about trying to quantify or pretend to quantify stuff that is pretty unquantifiable. Lydia, in her very good presentation, talked about solitude and spiritual qualities and other qualities that are important. And I think that can be quite persuasive to people that something is worth protecting because it nurtures those things. But I would be careful about trying to quantify that because there's a substantial risk that you end up actually reducing the believability of your material if you end up trying to put numbers on things that really are probably unquantifiable.
So I think that's a risk across the boards. I think that I'm just thinking about nitrogen management and water quality issues. We try to quantify that. We have huge uncertainties. There's risks even on something as straightforward and quantifiable as nitrogen management, I would say. I think there are indicators people are trying to develop, and it's probably worth pursuing, at least trying to figure out if there are ways to quantify these. I mean, for solitude, I know I was talking to someone at the Wilderness Society who was trying to figure out ways to look at accessibility and numbers of people in places to try to get at some kind of indicator of solitude. And I thought that was interesting to try to come up with metrics that actually might be able to help quantify some of these services. I think the valuing side of things, economic value, a lot of people have pushed away from economic value on, like the Forest Service right now has a new planning rule, and they have to incorporate ecosystem services into their national forest plans. And they've pushed away from valuation to evaluation more broadly and are trying to understand stakeholder values of things and trying to rank them in terms of importance rather than putting an economic value on them. And I think for some of these things like solitude and spiritual value, that may be the way, at least for now, that people are going rather than trying to put a dollar value on for some of the reasons you suggest.
Chris Bordier, would you want to come and grab the mic? It's all the way in the back.
Yes, this is Chris Bordier from CDC. Thank you both for excellent talks. I like them both. I think Frank has covered most of what I was going to say, but I'll reiterate a part of it, and that is you've chosen to look at indices and ways of costing it out. And have you looked to see if those really will make a difference in terms of how policies or things may be developed to use this? Have you looked at the accessibility of these things and their impact? I think when you go to looking at the health impact assessment of this and comparing to air pollution, that's a good comparison, except the problem with particulates and ozone, they're done one at a time. And when you look at what they're actually doing health economic impact against, it's a very narrow collection of diseases. They're not looking at the full spectrum that occurs economically because of the issues involved. And I think one of the problems you're going to have on the ecological side is it's going to be a lot of little things that you're going to have to be adding up. It's not going to be lung cancer. It's not going to be cardiovascular disease as one big disease with a big chunk of it coming from air pollution. It's going to be little pieces of parts, and convincing people of those little pieces and parts, I think, is going to be a bit of a problem.
And then you can hand the mic to the gentleman directly to your right, who had Santa Barbara. Do you have a response to that?
So, I mean, I think there's a lot of truth in that. So I'm not an economist, but I work with a number of them. And what I've seen done is primarily a focus on, when they're trying to do economic evaluation, on those services that they can put some values on. And as a result of that, it's kind of an incomplete analysis. They can't do the full suite of services you might want to value. And so there is a limitation there that they're seeing in incorporating values into their assessments. But I do think they also do tend to focus on those ones where there's a big benefit. So there's a lung cancer example in the, so I have an economist I work with who just did one on surf economics. He was looking at the economics of surfing and the different ecosystem services that play into that. And there's a big economic benefit from surf recreation. So
if I may, in a way, what I've heard also in Dr. Portier's comment is that often in health, we're dealing with chronic disease entities that are the culmination of multiple smaller negative impacts on health rather than impacts that manifest themselves with one exposure, one disease. And that becomes more difficult to quantitate, more difficult to communicate, and if you may, that's why we probably have such a horrible epidemic of chronic disease today, that we aren't good at dealing with that kind of complicated problem. We have gotten as far as we've gotten in improving human health with relatively simple things. One exposure causes one disease, one infection causes one problem, or we can say we can attack that, vaccinate against it. And I think that looking at your presentation and also yours, Tracy, I see that embedded in that, the bit of the PCB exposures that's responsible for the cancers is very hard to trace through the system and to quantitate. And then the fact that Tracy, in the model that you showed for climate and health impacts, that the ocean was not even in the model. I think it might be a reflection of that.
Okay. One comment I wanted to make was, I agree. I mean, if we try to chase down, that's why I think one question was, what research do we need in these areas? If we try to chase down these individual relationships between environmental conditions, not even just coastal, and adverse impacts to human health, we're going to be spending a lot of time and money to get not very much. I'm really wondering, something like this quality of life index that they've been working to derive out here for a couple of years, if there were some generally accepted measure of the quality of life for a region, that's something that businesses can take into account when they decide to locate or not, or leave an area, depending on the quality of life for their employees. So that's something that we may, I think it's worth some further discussion. Is there a consistent way to report on human quality of life as it's supported by the environment of a region?
Okay, next question.
Keith Martin, the Consortium of Universities for Global Health. But I did serve as a member of Parliament in Canada for 17 years, right across the pond from where Dr. Collier is on Vancouver Island, so you're making me a little homesick right now. I have a little question. Is anybody here from either a congressperson's office or a senator's office? Well, apropos to action, if I may suggest, you gave two fabulous presentations, and people in politics for the most part are not in science. So I think maybe one of the the challenges we have, if I may say, is the identification of the problem to them in everyday speak, the cost of inaction, and importantly, what solutions can be adopted that they can embrace, that they can actually rally around and implement is extremely valuable. And also taking those arguments and translating that for the general public so you build a political and a public constituency for action. So my question is, and this is something we've been looking at, is there a place, and perhaps you mentioned it, where there's been a compilation of practices, best and good practices that can address some of the ecosystem challenges that are in front of us? Is there a place one can go to look at those practices in management of water, air quality, land management, and so forth?
So, I would completely agree with you that I think speaking about ecosystem services as we have here is probably not the right way to communicate in the policy community and to decision makers and to the public. I think it's been funny having I've been the director of our ecosystem services program, and all the scientists are like, cool. And then everybody else is like, huh? What are you talking about? What is this thing? So I think we don't communicate in those terms. I worked in a Senate office for a while, and it's a very different language that I used in that role. But in terms of the best management practices, I mean, I'm not sure I completely understand the question. I mean, I think there are, have been best management practices developed for a suite of different things, but they tend to be in their stovepipes that we tend to usually look at. So we have different agricultural management practices for nitrogen and water quality, and we have management practices for different aspects of our environment and specific, services we might look at. But I'm not sure it's been usually framed in a broad ecosystem services or cross ecosystem services way before. But I'm not sure I'm answering the right question.
Exactly the question I was asking, because those solutions, it's vitally important, I believe, for those solutions to be in the hands of the public policymakers. They need the what to do. In the rise of NCDs and the effect that that's going to have on healthcare systems, trying to address zoonoses, Lyme disease, and elbowing that into the picture is going to be a big challenge. So how does one do that? I think what they're looking for, and which one can do, is providing a place where those solutions can be done, that policymakers can rally around and say, as you know, hey, we can adopt that. And then you have the economic argument to support that at a time of fiscal restraint. Then you've given them the what to do, the why to do it, and the economic argument to underpin that. And if you have that, in a tactical and strategic fashion to play that out on the Hill and in public, then I think we can get some really constructive action.
I just, one thing I'd add is I think, in a number of ways, best management practices do get developed as we learn how to do that. But I think we haven't necessarily looked at the trade-offs across best management practice. So this best management practice affects nitrogen and water quality, but what are the air impacts of that best management practice? That's not always considered. So I think we haven't actually always looked at these BMPs across their impacts just for a specific outcome. And so that may be something we need to do more of.
Okay, I have 4 more questions, and a couple are at the mic and a couple aren't. So just to let you know what I've seen, I have Jack, I have Linda McCauley, I have Al, and I have John. I don't know if I give John the last word for this session, but I think maybe that's what we'll do. So, Jack, and I'm sorry I didn't realize you were actually saying.
Jack Spangler, Harvard Roundtable member. I want to bring the discussion back to values and how might we actually quantitate solitude, reflection, and those aspects of how we heuristically know nature, or what nature means to us. And I like to say that we shouldn't shy away from doing this in a more rigorous way. Advances have been made on biophilia in design, in nature, bringing nature back into buildings with outcomes that are measurable, interpretable, and valued in decision making. And let's take it a next step. One looks at the research being done in Japan and Finland on the value of forest, immersion into nature, get in restorative functions, change of blood pressure, reduction of cortisol, production of dopamine and serotonin. And so why shouldn't we think of nature having those real therapeutic values for us and effectively expressed through contemplation, restorative value, cognitive function? So I think we're within a few years, I think, of really having those outcomes that we need to effectively adopt this into the parlance of economic evaluation. Look to sustainable return on investments and the progress being made in that arena and being applied to infrastructure, to take those things that are externalities and value laden, but putting a numeric on it and putting that in the return. And I think this will start changing the economics that we all think needs to be changed.
Okay. If there's not a response to that, I want to go ahead to next comment from Linda McCauley.
Linda McCauley, Emory University, and a roundtable member. I want to speak from the health provider viewpoint and how the health provider community looks at water. A lot of what we're talking about today is not part of what health providers even think about. I think probably it goes as far as advising pregnant women about how many cans of tuna fish they can eat a week. And I think there's lessons to learn about how we made the health provider community aware of air and air pollution and the effects on health. We've really not done a comparable job with water. I would say there's more concern about the quality of tap water in urban areas than any of the issues that we're talking about today amongst the public. And interestingly, when you talk about values, being able to see water, regardless of how polluted it is so therapeutic to people. So when I lived in Portland, Oregon, and the Willamette River was a Superfund site, the public still wanted property next to the river. And I think in Seattle, it's not had any impact on the therapeutic value to seawater, regardless of how polluted it might be. So we have some real messaging, social media messaging that needs to be done.
I wanted to jump in there a little bit. That's one of the biggest problems the partnership has faced is people look out at Puget Sound on a sunny day and they see the mountains with snow above it and they think it's in great shape. And they don't see the fish with liver cancer. They don't see the PCBs and the salmon. They don't see the fish consumption advisories because they're not buying their fish from a local fisherman. So I agree with you totally that it is that mixture of things. And this issue of, we give advice to pregnant women to only eat so many cans of tuna per week or per month. Yet when you talk to so many young women, I go to an OHH-driven Gordon conference, and the young women there say they are not going to eat any fish when they're pregnant at all because they don't understand where the risks are and what to do about it. And I agree, we do a horrible job of communicating that risk or lack thereof, and that's something we need to work on, absolutely.
Thank you. Al?
Hi, I'm Al McCartland from EPA. Your mangrove example was very illuminating, I think, and I was wondering if you thought, if we drilled down in the U.S., for example, was there enough data and studies available that one could, say, look at the differences between non-point source pollution and agriculture versus point sources for important water bodies like the Puget Sound, the Chesapeake Bay, or the Gulf, for example? And if so, are there studies that really have illuminated that so that decision makers would know at the state level perhaps or the federal level to know what the trade-offs are involved? And you could couple that with things like emissions trading or loadings trading and for a water body to see if there was a socially better way to achieve our water quality standards.
So I haven't seen anything like that done. I'm guessing that there's difficulties in getting sufficient data to do that well. But I think it would be a phenomenal thing to be able to do and to work toward.
And I was just going to say that here, in about 2008, I just put together a little 2-page paper on the issue of toxics in Puget Sound. And I pointed out we don't have even a crude loadings estimate to say, we know we have problems with toxics, with biological effects, with human health risks, but we don't have even the crudest loadings estimate to tell us where they're coming from. So for the last 4 years, the state has actually been doing and refining their loadings estimates and trying to get a balance as to where we can actually apply. Is it non-point sources? Is it point sources? Do we clean up sediments? So they're going down that road. But it's, you know, as everybody knows, when you start on something like that, it gets horribly technical and endless meetings. But I think progress on that particular aspect of trying to figure out where can we put the limited resources to achieve the greatest effect is being done here, I would say.
Yeah.
Thank you.
I was going to say, I think the Chesapeake Bay region is probably the closest to trying to put all those pieces together, but I don't think I've seen all the pieces put together.
Thanks, John Baldus with NIEHS. And this is similar to the previous discussion, but maybe a little bit different. Lydia raised, and Tracy, you're in a great area for looking at something that doesn't neatly fall into the usual biomedical risk assessment, where we can assign a value of a statistical life to anybody who has a health outcome. But you raised the issue of cultural values. And I'm wondering, and cultural values, of course, are not easy to impart across a population. They're, by definition, kind of unique to specific groups within our society. And the question is, people have been looking in places like Alaska at ecosystem degradation from climate change and impact on cultural values and mental health, which we don't really do risk assessment very well for yet. We could maybe, get it down to biomedical, but we're not there yet. So the question is, Tracy, in the Puget Sound, or Lydia, elsewhere, are you aware of people actually looking at mental health impacts and impacts from degradation of culturally valued ecosystems, and anybody putting that to economics and or just translating that in a qualitative way into policy?
Want me to go first, or I'll go first, Lydia. In Puget Sound, some of that is going to go into the quality of life index, but I'll tell you, John, I have not diving down into that lately to see how they're trying to do it. I think one of the biggest factors we have where this could come into play is in the tribal perspective. The treaty rights out here are extremely strong, extremely specific about what we owe the tribes as far as their access to their normal fish and game. And they are going back to the White House, and they are having the conversations about the loss of cultural values, not just the loss of fish for consumption, but the very culture of their tribes and how that's being affected by the region's inability to bring the sound back to where it was promised it would be for them. So I don't know. It's a good question I'll ask for some of the tribal folks out here. Are they actually explicitly bringing up cultural values and trying to put some bounds on that, either narrative or quantitative? I don't know if they are, but it certainly is a place where it could have a big effect and could really push the equation out here, I think.
It's not something I've seen.
Right. Well, I just want to thank our two opening speakers for some wonderful presentations, a great discussion. We now have time just for a very brief break, about a 5-minute break. And I also want to just say, since we did get started late, people in the audience just feel you can take a break whenever you need to. But right now we're going to take 5 minutes, change over to our panel, and we'll see you back here at 10:20.